So to begin our presentation, we need to talk about what the Affordable Care Act actually is, what it does, and what its intended purpose is. So the Affordable Care Act is a reform law that was implemented to increase healthcare insurance coverage for uninsured people in America. It was enacted on March 23rd, 2010 by our former president, Barack Obama. And his intention was not only to increase access to insurance, but also to reform the entire health insurance market as a whole. The key provisions of the ACA is many things, but to name a few: to expand access to insurance, increase consumer protection, emphasize wellness and prevention, improve quality and performance, expand the health workforce, and control healthcare costs. Its initial intention was to expand health insurance to 32 million uninsured Americans through both private and public insurance. And according to CPS, in 2010, there were 49.9 million uninsured people. That's 16.3% of the population. And now, as of 2020, the uninsured rate has gone down to 30 million. In fact, an 11-year research study found that 17% of diabetic adults under the age of 65 lacked health insurance, and after the ACA, the uninsured decreased by 17%. And then some reasons that people are uninsured have a lot to do with their demographic background. So it could be based on age, race, employment, and income. One of the facts about the ACA is that it actually sought to expand Medicaid coverage. So if you look at the top chart, the sources of insurance coverage in 2010, you can actually see over to the right-hand side that the uninsured is 16.3%. That is more than Medicaid and Medicare. Medicaid was at 15.9% and Medicare was at 14.5%. So there was a higher percentage of uninsured in the United States than those on Medicaid and Medicare. And then if you look down at the chart on the bottom, you can see that in 2010, the estimated uninsured in millions reached 48.2, and then now in 2020, it's down to 30.0 million estimated uninsured people.
The Patient Protection and Affordable Care Act made a number of changes to Medicaid, such as expanding Medicaid eligibility to all adults under the age of 65, even those individuals without any dependent children, with income below 133% of the federal poverty level. As of January 2021, 38 states and the District of Columbia have chosen to embrace the adult expansion. The ACA provides different states with additional resources for their Medicaid programs and gave them the option of expanding Medicaid. Under the ACA, Medicaid eligibility for most enrollees is determined using the IRS definitions of modified adjusted gross income. The objective of these income counting rules is to organize Medicaid determinations with eligibility determinations for the subsidies for coverage available through health insurance exchanges. States that expanded Medicaid to provide insurance to the new adult group revealed the largest growth in enrollment. Between July and September 2013 and July 2020, enrollment in Medicaid expansion states increased by 41.7%, and 27 of these states saw increases in enrollments of at least 25%. The ACA makes it easier for individuals to enroll in and renew Medicaid coverage. Finally, another Medicaid provision in the ACA contains a maintenance of effort requirement that prevented states from reducing eligibility below that in place on the day the ACA was enacted. This provision was in effect until 2014 for adults and remained through the fiscal year 2019 for children.
Both the federal and state government are able to extend the law's coverage gains and improve cost protection of plans. As of 2021, 39 states have expanded Medicaid, allowing coverage to more than 300,000 people. However, some states have put regulations on the eligible population. As encouraged by the Trump administration, many states have imposed work requirements for those covered by Medicaid, meaning the applicants of Medicaid must show proof that they are employed or actively seeking employment. This mandate could reverse the progress on healthcare coverage. The Affordable Care Act banned insurers from excluding individuals with pre-existing conditions. This means that the population with greater health needs and higher health costs are now able to get coverage. This has benefited much of the population, allowing for more individuals to get covered for chronic illness care. Even with these new changes, much of the population still remains uninsured. Since the Affordable Care Act has gone into effect, the percent of the population that is uninsured has decreased drastically. As of 2019, 32.8 million, or 12.1% of people under the age of 65 were uninsured. 62.9% had private insurance coverage, and 25% were covered by public insurances. In addition, the amount of time that an individual or family goes without coverage while switching policies has decreased. The average span between plans was over 1 year before the Affordable Care Act, and as of 2019 is down to 6 months between plans. Compared to 2010, before the Affordable Care Act, there are less people uninsured today. However, the number of underinsured has greatly increased. In 2019, 45% of U.S. adults between the ages of 19 and 64 are inadequately insured, similar to the numbers of 2010. This number comes from individuals not being able to afford the premiums, coinsurance, and out-of-pocket costs associated with the plans most appropriate for their needs. While the number of insured Americans decreased after the Affordable Care Act, the number of uninsured has increased the past few years. From 2017 to 2020, there has been an annual increase in the percent of the population that is uninsured. However, despite the increase in the uninsured, the number still remains substantially lower than before the Affordable Care Act. Approximately 73% of the uninsured population lists their reason for lack of coverage as not being able to afford the premiums or coinsurance associated with their plans. The growth of the U.S. income levels has not matched the increased cost of health care. Cost still poses a major barrier for a portion of the population. Further adjustments to the Affordable Care Act could help more Americans gain access to health care insurance. The use of the marketplace allows individuals and families to receive health care outside of the employer. The exchanges or health insurance marketplace is a platform that offers insurance to individuals, families, and small businesses. The exchanges began operating in 2014. The exchanges are set up for individuals or families who do not have employer-sponsored plans to compare insurance plans. This has created another way for the population to get access to health care. Exchanges serve both small businesses and individuals, but there's an exclusive market for individuals to be eligible for federal premium tax credits and cost-sharing subsidies based on their household income. The Affordable Care Act created the exchanges to extend health care insurance to the uninsured Americans. The exchanges promote competition among private insurers. Individuals and families can compare plans during open enrollment and apply for them. Families with lower income can qualify for tax credits through the marketplace. Many states offer their own marketplace, and the federal government offers exchanges to residents of other states. States have the option to develop and host their own exchanges, allowing them to be more specific to the state's needs. The state will make decisions regarding the governance, design, marketing, administration, technology, and other factors surrounding the exchange. If a state chooses not to host their own exchange, the exchange will then be ran by the federal government. There is considerable flexibility to the states that choose to host their own network. The biggest decision points are how selective the exchange will be in terms of qualifying plans and how it avoids disproportion of high enrollment of high-risk and high-cost individuals. High enrollment of these individuals would result in high costs and premiums to all individuals enrolling through the exchange. In Utah, all insurers are able to participate in the exchanges given that they provide the most basic requirements. In Massachusetts, they are more selective in their selection of insurers. This selection ensures that the plans meet minimal benefit standards and are standard across the tiers. States decide where to set focus in terms of coverage. They can choose overall performance of cost and quality, while others prioritize reducing premium price. All plans must meet certain standards in order to be sold on the exchanges. Marketplace sets requirements for individuals and families who use it, as well as the insurers offering plans on the exchange. The plans on the marketplace must cover the following: ambulatory patient services, emergency services, hospitalization, laboratory services, mental health and substance disorder services, pregnancy, maternal and newborn care, prescription drugs, pediatric services, rehab services, and preventative care, as well as chronic disease management. On the exchange, plans are presented in standardized information, allowing consumers to compare options, and plans will be publicly rated on factors such as quality of care, cost, and customer services.
In 2015, the Kaiser Family Foundation discovered that health insurance premiums increases were relatively small. Nationwide, premiums for exchange-based plans with a medium level of coverage increased by 2%. On another note, the McKinsey Center for the U.S. Health System Reform discovered a greater jump from 2014 to 2015, stating that gross premiums increased by an average of 6% for the least expensive plans on the exchange. The Commonwealth Fund studied the 3-year period before the ACA has been implemented from 2008 to 2010 and found that premiums on the individual market were increasing by 10% or more per year nationwide. Therefore, there were no major effects on health insurance premiums once the ACA was initially implemented. In October 2017, the ACA required insurers to reduce out-of-pocket costs for people with incomes below 250% of the federal poverty level, which resulted in insurers increasing their premiums to cover the added cost. In 2018, the lowest silver marketplace premium offered in each region increased abruptly by 29.7% on average. 28 states increased their average lowest silver premium by more than 29%. Many insurer increases for the lowest silver premium averaged negative 0.4% nationwide in 2019, and that caused many states' premiums to decrease. In 2020, stability continued and caused premiums to drop across all states by an average of 3.5%. According to the Urban Institute, 31 states had lower premiums in 2020 than in 2019. Today, due to COVID-19, the ACA makes premium tax credits available to individuals purchasing health coverage on the marketplaces, but only when their incomes fell between 100% and 400% of the federal poverty level. The American Rescue Plan Act of 2021 law passed in March 2021 under President Biden. This law expanded marketplace funding above 400% of the poverty level and increased funding for those making between 100% and 400% of the federal poverty level. According to Kaiser Family Foundation, additional allocated funding will yield lower premium payments for approximately 15 million uninsured people who are eligible to buy on the marketplace and the nearly 14 million people insured on the individual market. Many of the insured and eligible uninsured individuals have lower health insurance premiums as a result of American Rescue Plan Act funding. Health insurance premiums fluctuated since the implementation of the ACA. Today, premiums tend to remain at a steady rate. Even though premium results differ depending on the state, the overall results suggest that post-ACA premium increases have been fairly small compared to increases prior to the ACA implementation.
In regards to the number of Americans insured through the Affordable Care Act, in 2019, 11.4 million people of all age groups and income brackets enrolled for coverage through the marketplace. However, some believe the increase was due to Medicaid expansion and not marketplace enrollees. With regard to the quality of care improving, there was an increase in the quality of care. Between 2010 and 2014, there was a 17% reduction in the rate of hospital-acquired conditions to include issues such as infections, pressure ulcers, and adverse drug events. However, detractors point to the failure of accountable care organizations not contributing to an increase in the quality of care as failure. In regards to cost reductions in healthcare, in 2019, 9 out of 10 marketplace enrollees qualified for financial assistance with their premium costs, with the average enrollee owing just $87 per month after obtaining assistance. However, detractors point to the increase in out-of-pocket maximums between 2014 and 2017 from $6,350 for individuals to $7,150 and $12,700 for a family to $14,300 as a reflection that the Affordable Care Act did not accomplish its cost objectives. Regarding the marketplaces as an option to purchase insurance, state-based marketplaces were very instrumental in providing coverage to many Americans. However, the federally facilitated marketplace and state-based marketplaces need to collaborate more with funding through the federal government for greater outreach. Regarding Medicaid expansion, states could financially gain from Medicaid expansion. Furthermore, expansion would increase federal revenues by $49 billion in 2022 and would create 1 million jobs. Additionally, expansion would get 2.2 million Americans out of the coverage gap. Lastly, the efforts toward universal health coverage that birthed the Affordable Care Act needs to continue. This can occur through public and private partnerships to ensure all Americans have coverage and access to health care they need.
A law is only good if it is constitutional. The ACA is constitutional because it applies equally to all United States citizens. It expands access to millions of Americans, and it balances individual rights with collective interests. Healthcare is a right, not a privilege. The ACA is one step in the right direction to ensuring that all Americans can obtain healthcare services and not be denied insurance benefits based on their age, gender, national origin, disability, or income level. The ACA has also been proven to be a good law because it has survived multiple lawsuits. The Supreme Court has heard over 4 cases regarding provisions of the ACA, and each time has ruled that the specific provision of the law is in fact constitutional. It is estimated that over 133 million people in the United States have pre-existing conditions. Without the ACA, many people who are not eligible for an employer-sponsored health plan would also be ineligible for a self-subscribing insurance plan. If the ACA were canceled, millions of Americans would be unable to afford their health insurance premiums. The ACA provides tax credit subsidies, often meeting nearly all of a family's monthly premium to maintain continuous health coverage. Tax credits and subsidies provide assistance to millions of families paying monthly health insurance premiums to keep their coverage intact. Prior to removal of health insurance caps, people with chronic health conditions and terminal diseases were forced to pay exorbitant out-of-pocket fees for medical bills, even after they met their deductible. Insurance companies could also put enhanced qualifiers on what they would cover. Many insurance companies did not extend coverage for mental health services, including couples therapy, cognitive behavioral therapy, and treatment for addiction and substance abuse. Other medical services with measured health benefits like chiropractor acupuncture treatments also were not covered by most private insurers prior to ACA passage. In addition, rights in the workplace were expanded to cover nursing mothers and expecting parents. For example, all insurance plans on state and federal marketplaces must cover maternity and newborn care. Most prenatal care is covered with no out-of-pocket costs to the expecting parents. Women's health and preventative care like yearly pap smears, mammograms, and STD screenings are also covered at no cost to the insured. The ACA could be improved in several ways. It is not a perfect law. No law is perfect. And it is not immune from attacks from both sides of the aisle. Expanding the open enrollment period could assist individuals and families in choosing the plan that fits their needs. Abolishing or reducing waiting periods for benefits to begin would also help families who are between coverage options or seeking short-term coverage. Public health agencies need to address enrollment gaps for young adults, adults for whom English is a second language, and low-income adults. Many people who are eligible for Medicaid are not enrolled or are not using preventative health benefits available to them, and health illiteracy is preventing them from making informed decisions for themselves and their families. Addressing this gap in educational guidance is crucial for public health agencies and state exchanges.
So in conclusion, the ACA was originally created to expand access to healthcare for uninsured people. Overall, the ACA has done a lot of great things. And to name a few, it has expanded Medicaid to those that are under the age of 65 and 133% or below the poverty rate. It has increased enrollment by 41.7% in Medicaid. It has increased the population of insured individuals, so thus decreasing the uninsured. And it has allowed states to expand coverage beyond federal requirements. And that is because some states may have different requirements that fit its people better than others. So it's nice that it can be changed around or expanded based on the state requirements. But it has also increased the underinsured due to high premiums, co-insurances, out-of-pocket costs, and these are all due to the reduction in marketplace out-of-pocket costs. The ACA also promotes equality because it offers insurance to everyone. Doesn't matter your demographic or your background or anything like that. It offers insurance to anyone that needs it, and it protects patient rights. The ACA also increases preventative services, screenings, and mental health services for all because there are a lot more insured people now that can use these types of services or seek mental health advice because of their insurance. But some recommendations are that the ACA could improve by reducing their waiting periods, expanding federal matching rates to states, increase tax credits for the self-insured, and reduce enrollment gaps for the underserved.